Hi, welcome to the Organizational Change Management Project. Today I'll be introducing the Member and Family Advisory Councils. The Member and Family Advisory Council will be housed in the organization that's called the CRS Clinic, which is a multi-specialty integrated clinic that they provide services to high needs population and medical fragile children. The identified issue or the main issue that we're looking at is the difficulty engaging with assigned members. And so with that, it has resulted in the inability to meet the state deliverables or required contracts. And then it results in premature closures. And then from those, it results into many other different types of challenges and barriers that we are seeing that affects the entire organization. So the assessment and evaluations that were used, the first one is the logic model. The logic model allowed us to break down everything that we wanted to see and really show the relationship between the goals that we have in mind and all of the issues and challenges that we've seen on the previous slide, that we can actually break those down and address each one of those goals. So that's what the logic model did, is provide us with basically our own plan of how we're going to provide this intervention. And then the force field analysis allows us to be able to insert a goal, any goal, in the middle, and then really see what the factors are for the negative versus positive force fields that would push that change either way. And then we can identify what some of those barriers would be and start working on those. The great thing about the force field analysis is that this assessment tool can be used ongoing. So the council themselves can insert any goal into that and really just work it out and see how which goals they're going to prioritize and really have a plan to work out. Some of the other assessments or sub-assessments that will be used are surveys and focus groups, and these will be used for the staff, for the council, and for the clients themselves. And then through those sub-assessments, we'll be comparing the results to see back to the logic model to see if we are actually obtaining the goals that we had set out to obtain. So what the assessments have revealed is that clients are having a lot of fear and anxiety. They're overwhelmed, they're uneducated, they're unsupported, isolated, and misunderstood. So those are what the clients are expressing through those various assessments that we were able to use. And then the staff really feel that, you know, they want to make a difference, but they're having a very difficult time understanding the clients that they're working with, and that if they were more involved, that they could take their care seriously and be able to see better outcomes within their own health care. And so what the intervention plan, the MFAC, or the Member and Family Advisory Council, what this would do is that it would have at least half of the members be either members or family members who are receiving services. They'll consist of staff advocates, and then leadership will be required to attend these meetings on a quarterly or biannually basis. And what this council is going to do is allow shared information, shared goal setting, shared responsibilities, and really bring us to what our outcomes are, which is really meet the needs of the clients, creating a strong partnership with the clients and the communities. And then ultimately it will affect the funding sources and be able to expand on services, especially with innovative services. Now, the evidence of implementing the Member and Family Advisory Council, you can see here, is that there's a patient care model that they have used. And what is pretty surprising is that frontline staff have also recognized that including the client into their care has increased success. So and then when we're talking about a whole business model, the PAC, which is Patient Advisory Councils, have led to many meaningful changes within organizations. So that's the evidence that the MFAC is based. So we can see here that the best practice for using the Member and Family Advisory Councils attribute a lot to the success of the organization. First and foremost, it helps promote education on both sides from the organization as well as the customer side. We see higher improvement levels, higher outrates, outcomes, just lots of nationally recognized benefits to implementing Member and Family Advisory Council, and that is considered best practice for an organization. And then first, when we're looking at involving customers, it's really just good business to do so. If we look at the factor that in healthcare, member and families are involved in policies that affect services that the organization provides, as well as the funding and how much funding and where the funding goes and all that good stuff. So if they're involved at that higher level, it's just good business and makes good sense to involve them within your organization so that they can keep your priorities in mind when they're involved at those bigger levels. They also have been attributed to business sales and advertisement. So if things are going great, they're your best advertisement. They're the ones who are going to refer their most trusted friends and family members. And then they bring market intelligence, what's working, what's not working, what needs to be changed, and they can actually assess for risks before they even happen and work out some of those risks. So risk mitigation. So it's just really good business. And then challenges and limitations that could arise is time. Time on the family side, time on the staff side, time on the leadership side. Those all can be big barriers and challenges. Client recruitment, because they are the sole caretakers of their medically fragile loved one, it might be very difficult to recruit clients. So these can really be worked out and problem solved, but it's going to take a lot more effort. And then sharing of responsibility might be very difficult on both sides, on the professional side as well as the family side. And then accountability. This Family Advisory Council is going to show and hold accountability to the organization as well as to the clients who are receiving care. So that needs to be kept in mind. And then diversity, making sure that when we are doing client recruitment, that we really get a diverse population and experiences so that we can really have a well-rounded understanding from the consumer's point of view. And then just to reflect on this project, what I would like to have changed or to improve on is I would like to actually conduct a comparative analysis assessment for the leadership's beliefs on how the Member and Family Advisory Councils would work before the implementation, and then a year after, and then 2 years after. I would like to see what those changes would be for those leadership's belief on the Member and Family Advisory Council. And then what I learned is that the assessment tools can really be used in a professional sense to really drive that change that we're looking for. I got into this field to really make change, and by learning some of those assessment tools, it's more than just saying, hey, we need this change. It's really putting data where it belongs. So data driven and client motivated to make real changes. And then what I would like to do is really make this Member and Family Advisory Council in the CRS clinics. I would really like to make this a real intervention. And thank you everybody for spending this time with me for this presentation.